It's your health. Summer and early fall months are some of the busiest times in emergency rooms. Dr. Stefanie Shustek, ER physician at Belton Regional Medical Center, has tips to avoid the ER and prevent injuries and illness. Good afternoon, doctor.
Good afternoon, Kelly.
Tell us, why are summer and early fall months the busiest?
Summer and early fall, it's a great time to be outside. The days are long, they're warm, they're hot. People are outside doing activities, lighting bonfires, riding ATVs. It's a great time to be outside. It's also a great time to get injured.
So what do you recommend to keep the little ones out of the ER?
Well, especially the little ones, for sure, protective equipment, going bicycle riding, wear a helmet, using a skateboard or a hoverboard, helmet, possibly knee pads, wrist guards. And if you're going to do like a bonfire or a campfire, definitely supervise the younger ones. Even the teenagers, they tend to be a little reckless with the flame. And then just observe, just keep your eye on the kids would be the best thing.
And sometimes we don't know as parents, do we call the doctor and see if we can treat this at home? Do we go to the ER? How do we decide?
It's kind of a gut feeling. As a parent, I'll look at my child and say, oh, that looks bad. Maybe I should go to the ER. But, I would always call the doctor first. Listen to the advice that they give or their nurses give, if they feel that it can be a non-emergency that can wait. But if you feel that it's an emergency, then absolutely follow your gut.
And you say this is a busy time for ERs. COVID probably is not helping the situation with an already busy emergency room at Belton Regional. How is it there at the hospital now?
It's crazy. We are seeing a significant influx of patients that normally wouldn't be here and that are significantly sicker and younger, especially from the first wave a year ago or a year and a half ago at this point from COVID. The numbers just keep on increasing and the patients just keep coming. As a hospital is a finite unit, we just are making do and putting beds where we can, but a lot of hospitals in the area, including our own, sometimes just don't have the room.
Is there anything else you want to tell us about staying out of the ER during this busy time?
To stay out of the ER, just stay healthy with this heat wave, this heat index, stay hydrated. One of the most important things that you can do with COVID is get vaccinated. We're seeing a lot of younger people between the ages of 30 and 50 with no previous medical problems that are having severe symptoms, severe respiratory distress, need to be put on machines to help them breathe, medications immediately upon arrival. So definitely staying healthy. If you think that you have symptoms or if you have tested positive for COVID, wear a mask, isolate if you can. And then those are the main things that I think that would be important for right now.
All right, thanks, doctor. All good tips. And for more stories just like this one, head over to our website, kctv5.com/HCA Midwest.